The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees. Now, time for a break with Central Illinois' own Gretchen Wirtz.
Welcome back. I'm Gretchen Wirtz, and today we are talking about some new medical care coming to the heart of Illinois and to Peoria. And joining us today from the Springfield Clinic is Dr. David Akerele. Dr. David, thank you so much for joining us today.
Good morning, Gretchen. Thank you.
First of all, let's talk about Springfield Clinic. You guys, they're expanding. They're coming here to the area. Tell us a little bit about what Springfield Clinic is.
Yes. Yes, they're kind of coming and expanding in the area. It is a physician-led and managed group. They started in Springfield, Illinois, and now they're up in this area. So we're expanding primary care, and we are Springfield Clinic Pediatrics. We're located on sort of the intersection of Knoxville and Lindbergh, close to where Kroger is, and so that's where we're situated now.
And what makes you guys different, I guess, than, Peoria's got a lot of hospitals and doctors already, here in the area. What makes you guys different, and what's going to be different, and what do you guys bring to the table?
A couple of things. So innovation, a lot of use of modern technology for practice styles. So the use of telemedicine, for instance, for convenience of care, sort of incorporating an old school feel of practicing medicine with implementation of modern technology for ease of patient care, things that will help improve customer satisfaction, ease of the visit, and convenience, that kind of stuff. It's also driven by physicians who are reacting to the needs of their patients. So instead of having more of a corporate structure on an executive level managing, the board is made up of all doctors. Each practice site is owned by a physician. And so I think that gives a unique flavor to each practice on a practice to practice basis.
Okay, I like that. Yes, maybe sometimes too much of the corporate can intimidate people. So this definitely sounds like a really unique and different approach. You guys are accepting obviously new patients. Do you accept walk-ins? How does it work with insurance? Do people just make an appointment? Or you have a great website?
Yeah, so we have a website. We have a phone number, so you can call 309-323-6068 and call to schedule an appointment. We are accepting walk-ins, for sick visits, for flu shots. You can call and schedule. So yes, and then we are seeing private and state-funded insurance also.
Okay, very good. And
patients are welcome.
Okay, very good. Yeah, I was looking on the website. It's it's a really easy to use website, very helpful, and you can find a lot of information on there as well. So pediatrics, that's kind of the niche that you guys are bringing here to it too. What kinds of things are you going to be offering for pediatrics in the area?
So I'm going to be practicing with my partner, Dr. Amanda Stovall, and she's board certified pediatrician. So both of us will be practicing general pediatrics, and we're comfortable seeing age 0, so newborns, all the way up to college kids. So when they're ready to be checking out of the house and get their first job, that's kind of like our job. I'm also board certified as a pediatric infectious disease doctor. So my scope of practice is a little bit broader. I also see outpatient ID and some public health type things. Like, so COVID has been in my space in the last couple of years, or the year and a half. And then I see travel medicine. So those are things I'm really passionate about.
Oh,
and then
wow.
Even within the scope of general pediatrics, I enjoy managing children who have neurodevelopmental issues, at least their initial management and co-management. I enjoy some of the diagnostic part of medicine, so complicated cases, managing children who have chronic diseases, and behavioral management. So some of the things you may be familiar with, ADHD, basic things in mood disorders like anxiety, depression, and then working with a psychiatrist or other behavioral health docs to get the kids in a good space.
All right, well, I like that. I kind of hope I don't have to see you for that, but I'm glad to know that it is here. Dr. David Akerele, thank you so much for joining us, and definitely find out more about the Springfield Clinic at springfieldclinic.com, and they're right there in Peoria on Lindbergh Drive. Dr. David, thank you so much for joining us, and we will see you next time. Yep.
Thank you.
Bye-bye, and we will be right back.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.